So I want to start off broadly and just get right into it. How would you describe the world of nursing in 2026?
So I would say we're at a crossroads right now. It's definitely the most rewarding profession you can imagine, but there's a lot of unrest.
Yeah. So I want to ask about some of that unrest. Obviously, right now in New York, there's 15,000
Yes.
people on strike.
Yes.
Is that indicative of a larger problem? I mean, I
Yeah.
hear there's a nursing crisis all over the news. Can you tell me more about that?
Sure. The Kaiser Permanente nurses in Hawaii and California are also striking at the moment, so that's not quite as big as the New York City nurses, but and largely what they're striking for is safe staffing ratios. So kind of a product of our climate these days, our corporate climate. Nurses are taking on more and more responsibilities, bigger patient loads, and have tried to come to the table to negotiate fair staffing ratios. It hasn't been so effective, so.
Yeah. That corporatism, is that a huge trend rising in like the world of nursing? Is it getting more?
Yes,
Yeah.
yeah. Healthcare has become very much a corporate entity.
Interesting. So, what specific, like when you hear the term nursing shortage, I think it confuses a lot of people. Because at least for me, I go to school and I thought half the girls were going for nursing.
Right,
And so you
right.
hear there's a shortage, and that confuses a lot of people. Can you sort of help explain what the shortage actually means?
Sure. I think nationwide you might be able to say there's a shortage. In Massachusetts, we're extremely fortunate to have so many schools of nursing. There is no shortage of nurses in Massachusetts. There is a shortage of nurses willing to work in the current climate. So we have plenty of nurses out there. We do also have a huge influx of nurses that are retirement age. So we're losing a lot of our workforce at the same time as we have a baby boom generation that needs a lot of care.
Yeah. So those specific challenges in the workplace climate, what do those look like? Is it overstaffing? Is it over you have too many people that you're working for one nurse?
Yeah.
What does it really look like?
So what it really looks like is nurses are taking on larger assignments with less support resources. So, maybe you used to have a unit secretary that's answering the phone and, fielding visitors coming in, and that you no longer have that resource, so the nurses are jumping in to do that. So nursing is a little ill-defined as a discipline. We tend to cross boundaries with all sorts of roles: PT, OT, speech therapy, unit secretary, staffing coordinator. So the nurses are now taking on those roles where we used to have layers of support, like a charge nurse that didn't have an assignment on a unit. Now that charge nurse is taking a full assignment and still being expected to do all of the paperwork, management kind of work on top of.
So I know you serve as a registered nurse at Beth Israel.
I do.
Any stories there of just times you've been overworked personally? Or?
My unit actually tends to have really good staffing. I work psychiatric care in the geriatric population, so it's a little bit of a double whammy. We tend to be staffed pretty well, but what happens is when we have a crisis, it's usually behavioral in nature, and we're the last ones to get the resources. Med-surg will always take precedence. So if we need an extra set of hands on deck, we're going to be the last one to get them. Say I need someone on one-to-one supervision. We don't often get that help.
Yeah. So with that in mind, like facing those challenges as a nurse, when you're talking with the young students here who are going into that field, what's the immediate advice for them?
Have a voice.
Yeah.
Be careful where you choose to work, because they can choose where they want to work. It's no longer, when I graduated nursing school, there weren't a lot of jobs out there. So you were worried about just getting a job. And we used to say, you had to do your time on med-surg. So you were stuck with doing med-surg, overnight shift, weekends, holidays, the whole 9 yards. I think now, given the current climate, our students can go anywhere they want to go. They can choose specialties right from the beginning of their career, if that's what they want to do. And I think that there are places to work out there that are mindful of their employees' well-being and the patient safety.
I want to ask about those students going ahead, looking towards the next 10 years, with that crisis nationally, at least in mind. What do you see the future of healthcare for nurses looking like, or just the job itself? Do you see any big changes in the next 10 years? Or?
I do. I'm hopeful that there will be some changes to staffing levels that will encourage people to stay in the profession maybe a little bit longer than they otherwise would. Are those nurses that are now doing other things come back to the profession? The pay is phenomenal. It is. So I think we're going to definitely have a problem in our long-term care settings, which corporate is already responding to. We're going to med techs. They're not licensed persons administering medications, which may be a big problem. They're not thinking that through clearly, as far as I'm concerned. So there'll be less nurses in the long-term care settings. They'll move into more acute care, hospital settings. But I don't think that will work long-term. I think they're going to have some problems.
With these corporations or at least these big corporate hospitals, right? What specific changes do you think they need to make in order to facilitate sort of a better world for nurses in the future? Or what are they doing wrong?
It seems to me we have top-heavy, a lot of administrative, a lot of the money and the funding.
I was going to say, I'm sure salary-wise,
positions. And then a lot of it isn't the hospital. It's our insurance industry, our pharmaceutical industry. If you go to other countries, they have much better healthcare results than we do in our country, and they spend a lot less money at the same time. So we're putting all of our money to pharmaceutical and insurance costs.
Very ethical industries right there. I want to ask though, with right now the current climate, at least politically, with Medicaid, with the cuts that have been made, have you experienced any difference in people coming in or how people are getting treated, whether they don't have insurance?
Yes. Particularly the unit that I work on, has been reduced to half the size of what it used to be. Half the beds are dedicated to Jerry psych patients. And it's largely because it's not a moneymaker. So what's going to go in the other half of the unit are the same type of patients with medical issues. So insurance will pay more money for those patients. And a lot of times in my world, my patients kind of get stuck with us. So their insurance runs out. The hospital's not making any money, yet we're providing care for them. So, you can see that dilemma of you can't lose money on patients coming in. How are you going to pay people to be there?
Yeah.
But by the same token, I think we have an ethical responsibility to take care of our geriatric population and everyone.
Yeah, I mean, I see it with people my age. I have a lot of friends who don't have health insurance, and especially if their parents are providing it for them, they can't afford it, and they don't go to the doctors.
Right.
And I think you can see maybe in the next 10 years a lot of health crises popping up just based on the fact that people aren't going to the doctors and aren't receiving help. I guess my question is, do you worry at all that the pure profit incentive for these companies is stopping people from getting the health care that they really need?
Yeah, there needs to be some political, unfortunately, policy drives everything, law drives everything, so there needs to be some intervention into, the upper echelon, all the money going there, and everyone below is suffering. It comes down to a philosophical argument of whether I believe that health care and education should be rights, not privileges. They should be a right to all, not a privilege for only those that are wealthy. So, philosophically it comes down to that, and that's got to be argued in a political arena.
Yeah, but I think the conversation will shift more that way as more people experience, what not having health care looks like.
Right.
But time will tell. Another thing I wanted to ask you about is tech is like a big thing in the medical world.
Yeah.
And I think over the past 3 years, we've sort of seen tech with AI skyrocket in 100 different ways. But medically, I feel like you're not hearing as much news about it as you think. Is there anything you know as a nurse that's changed since, AI or tech's gotten better?
Well, I don't know so much AI, aside from, just resources. Patients come in and they're experts on
That's
their own
frustrating.
care, for sure. But technology-wise, it's astounding in the 30 years that I've been practicing, the amount of technology that's come into the healthcare setting. That really, honestly, makes our lives a lot easier in some ways. It's a lot more to learn, but I think of documentation systems alone are a godsend. So,
Culturally, are there any big differences between, 30 years ago, you started your journey in the world of nursing, as to today, you're still a nurse. Are there any big cultural differences in the workplace?
I think you've heard about the thing, nursing is not a profession. No, it's just a designation for funding, but that has repercussions on our higher degree nurses, our nurse practitioners, and healthcare is, it's really driven by nursing. Nursing is the hugest workforce in the country, in the world,
Really? That's
It
fascinating. I
is.
didn't
It is
know
the
that.
hugest workforce in the world. And a lot of our care is moving from doctors to nurse practitioners, having prescribing rights and guiding the care, driving the care. So I think culturally, nursing has fought long and hard to have that designation. That's why it's such a heated argument about, professional status.
Yeah.
I don't think that anybody thinks we're not professional in the
Yeah, until you brought it up,
colloquial
I've never
sense.
heard someone refer to a nurse as not professional.
Right. But the government designation allowed for funding, much like doctors or people that need degrees that take more than a standard amount of time to get.
So, sorry to cut you off. No, when you asked that, I immediately thought, just with the government and the state, as opposed, because there's private hospitals too, right? Private and public hospitals.
Right.
Have you worked in both, or are there main differences between the two?
Not that I see in the day-to-day. I really have always worked for a nonprofit.
Yeah.
I can't think of a time that I've worked in a private setting. So I don't know that I can answer that honestly. I think I know that the amount that you can charge for the same care from one institution to another can vary drastically. So there's no regulation of what hospitals can charge.
I'll tell you what, from personal experience, recently I went into an urgent care, and it was for a cut on my hand. I walked out, and my bill was $400 before insurance, and they didn't do anything. It wasn't no stitches. They just looked
Right.
at it. And I think a lot of people are seeing the prices without insurance are absurd, and it sort of feels like they're only being done so that way, one, you have to get insurance, and two, the insurance companies can justify having the price as high as it is. Do you see, is that what's going on? Do you see that changing? Or?
Yeah, I mean, I don't look at billing much as a frontline caregiver.
Right.
I don't get to see the bill that people get, but I know from news reports and reading articles that that's definitely an issue.
Yeah.
And if you had walked into the emergency room, that bill might have been $800 instead of $400.
Yeah.
So,
And I mean, you see it down to all aspects of healthcare. I mean, dental is just as expensive now. I want to ask about what barriers do you see preventing people from entering the nursing world that maybe, want to enter? It's an expensive field to get into. It's nice that we have this college here, which is providing schooling for free to get into nursing. But I know a lot of people who had to struggle really hard for, sleepless nights, working 2 jobs to become a nurse. Is that a common story you hear a lot?
yeah, the rigor is intense, and it has to be. You're dealing with people's lives, so our admission criteria is different. Our passing grade is a 77,
Yeah.
whereas in the rest of the college, it's a 60-something, right? So we need to know that I can send you out the door and have you practice safely and also be able to pass the NCLEX, our national exam. So the rigor is intense. We try to put, testing and ways for people to keep their grades up that aren't as high stakes, but it's very difficult because at the end of the day, you still have to take that test.
Right.
You can't get the piece of paper to practice without it.
And at the end of the day, you're dealing with people's lives. So it's
And
it's
there it
incredible
is.
what nurses do. It really is. How do you prepare those graduates for going into the field, though? I mean, it's high stress constantly. Is there
Yeah.
anything that in your class you do to like prepare them for going into that field, or is it just you need to walk in and learn?
We do, every semester, they do 135 hours in a clinical setting. We cover 4 specialties: psych, community, maternity, pediatric, and then the rest is med surg. So they're getting a lot of hands-on. We have a beautiful lab on campus. So we're able to do the hands-on in a non-threatening. We have a simulation lab, so we can literally simulate a patient scenario. We have a mannequin that births babies.
Wow.
So, yeah, it's pretty intense. So we're doing it in a non-threatening environment first, then taking it into a real-world clinical practice with, we're fortunate we take groups of no more than 8. When we go off Cape Cod, it's 6 because that's the rules of our clinical partners off Cape, no more than 6 students per clinical group. So it's very intense, one-to-one almost
Yeah.
supervision, so that they can get as much experience before stepping into the real world. That said, it's a clinical practice.
Yeah.
So you gain knowledge with experience. And then as far as, you'll know a nursing student walking around campus, their head is always in a book, they're always in a study nook. There's a massive amount of reading, high stakes testing to get them prepared for that NCLEX examination, and to really get them critically thinking. So the whole objective is to teach them how to critically think so that you can transfer knowledge from one situation to another.
Hearing you talk about that, it reminds me of something you said earlier in the interview, where people come in and they act like they know everything about, being their healthcare, right? I think I've seen a lot of people become experts on health over social media, especially over the past 2 years. There's a lot of distrust in vaccines, but as well, there's just a lot of distrust in doctors generally. Hearing you talk about how hard these students are working, how hard you work, and how hard nurses work, that must be frustrating, right?
I go into a healthcare setting with, if you're my patient, you are the expert on your own health. I'm going to educate you about but everybody's different, right? We're our own little petri dish. Everything's going to work a little different with each person. And I think that people need to have some agency over their own care. Now, I work psych, so a lot of times we take that away.
Right.
I'm making the decisions, the doctor's making the decisions. But, in general, I think there's a lot of information out there, and unfortunately AI, a lot of false information. So we have to dispel that kind of thinking all the time. But I do like to give my patients a lot of control over their own care. I can tell you to do anything, but if you don't buy into it, it's not going to happen.
There's been a lot of, I want to sort of ask what you think of that. I feel like there's a new wave of anti-science on the internet, at least. And a lot of that relates back to, like the vaccines and...
And we have lots of measles going on now. It was on the news last night.
But you see the leader of the FDA, RFK, he talks about a lot of stuff that's anti what doctors have been saying for 10 years. It seems like there's a lot of, the stuff with ibuprofen and pregnancy, that was a huge talking point for a long time. And I think it's still a thing that's being debated right now. And my question is just, is there a change in the way the government's handling, like, procedure generally? Are you seeing that?
Yeah, absolutely. And that, it's going to when you have someone that has a platform like that, it has broad-reaching consequences. And I can't say I don't agree with some of the things he says. Our diets are terrible. Most of our sickness in our society is lifestyle driven. We're overweight, we eat poorly, we don't have good, healthy habits that start from childhood.
Yeah.
So I agree with, not having supersized McDonald's meals, and I agree with a lot of that. However, some of the rhetoric out there about, vaccinations, it just has such far-reaching consequence that I don't think Joe Q public really understands.
Right.
Really understands that if there's not policy in place supporting this, then insurance no longer has to pay for it, and then only the very wealthy have access to what should be a right to everyone. And I don't think we understand, we're seeing now, we have something called herd immunity.
Yeah.
So there are instances where vaccinations are dangerous for a patient, say a child with special needs. It would be dangerous for them to have them, but if everyone around them is vaccinated, it's somewhat of a protection. Once we start getting these huge populations that aren't vaccinated, it's just all going to go rampant.
Yeah, and it makes you think back to COVID, which feels like 10
Yeah.
years ago now, but I imagine for you that must have been the most stressful time in the world.
It was wonderful. I got
Really?
to stay home with all my kids came home, and Zoom, teaching nursing on Zoom was not the best thing in the world, but I really enjoyed being home with my family.
Are
To
nurses
be honest.
100%, like in healthcare generally, are we 100% bounced back from COVID? Are there still any,
Oh, gosh,
long-lasting
no.
waves
Yeah,
from that?
well, you know what? I very frequently mask, and I worked through COVID in the
Yeah.
hospital. I did, but I work on a very closed unit,
Mhm.
and there were no visitors allowed.
Yeah.
Which ethically, that's hard. We ran around with iPads all the time, with family members and even doctors, providers
Yeah.
that were seeing their patients via an iPad. But I think we learned a lot from it. There's a lot less staff getting sick on the unit for sure because we mask all the time.
Yeah.
Any sniffle or sneeze and everybody's wearing a mask already. So, are they 100% foolproof? You're not going to get an illness? No,
Yeah.
absolutely not. But they do protect you somehow. We saw the rates of flu go way down when we were masking.
I think talking to you has made me honestly more optimistic than I was before about the healthcare industry. I think online over the past couple of years, I think it's hard not to only receive negative news. But talking to you, you seem hopeful about the
Oh,
nursing
gosh,
world
yeah.
being better, and hearing you talk about your students is very
Everything's
inspiring.
a pendulum. Everything's a pendulum. It'll come back. We're at a crossroads right now. We need to use our voices. We're a large group. But absolutely, we have to have it. We have to have it.
The last thing I want to ask you is just, you've mentioned we're at a crossroads right now. What main things do you think would put us on the right path in that crossroads?
I think we as a society have to start thinking about health care. We had the Affordable Care go into place, and it wasn't perfect by any stretch, but we were moving in the right direction of taking care of everyone.
Yeah.
And I think it's being dismantled a little bit right now. We need to get back on track.
Yeah. Well, thank you very much.
Thank you.
It's been a pleasure. Thank you.
Thank you.